in regards to treatments that are available to help with erectile dysfunction and sexual dysfunction from prostate cancer treatment, the main things are, there's three things. There's tablets, so there's medication called tadalafil, sildenafil and tadalafil, okay? They're big words, but you should see your GP or your urologist if you're wanting to have some medication to help treat your erectile dysfunction. And how these medications work is they actually encourage more blood flow into the penile tissue and help prolong your erection. So if you were going to use this medication, most commonly you'd take the tablet, wait about an hour and then stimulate yourself to try and get an erection. It works along the same nerve pathway for erections as those for the neurovascular bundles. So if you don't have your nerves spared, say from surgery, those tablets aren't usually going to work for you. So that's why it's important to talk to your doctor about that. The medication can also be a daily dose depending on what you choose, or just on demand, which is when you take it, like I said, wait about an hour and stimulate to try and get an erection. Okay, you need a prescription for that medication and you would need to speak to a doctor and your urology nurse or your GP about that. Another option is a vacuum erection device. So a lot of people haven't seen these before, but they all kind of work about the same way. So it's a hollow cylinder that works by suction, okay? So what you would do if you're going to use this is you'd get some water-based lubricant. You'd put lubricant over the base, lubricant over the penis, and then you'd place this over the penis and make sure you get like a very good seal, and then you'd slowly pump it. Now there'll be an instruction sheet with whatever pump you purchase, and the pumps really vary in terms of the cost of how expensive they are. You don't want to pump it too quickly because that can cause bruising and pain, okay? The main thing for using the pump is getting a really good seal. So sometimes you might need to shave around your groin to make sure you get a good seal, because hair can kind of impact on that, okay? So if you pop this on, make sure you get a really firm kind of pressure and slowly pump it, okay? So usually it's about 2 pumps, wait a minute, and then 2 pumps, wait a minute, and you'll see your erection kind of develop in the chamber, okay? There should be a safety valve on the pump to be able to press if you've put too much pressure in there and it causes pain, so then you can help your erection go down quicker, okay? Now, if you're wanting to use it to get an erection to have intercourse, you need to put some kind of constriction band on the base before you actually use the pump. So this is an example of one, and you can buy these when you purchase your vacuum pump, all right? So again, same thing, if the penis is going inside, you're pumping it up slowly. Once you get the erection, you then flick this over the base of the penis and take the pump off, okay? Now, the thing with the erection that happens after using the vacuum pump, it's different to an erection that would happen that you would be used to just as a normal erection, or even an erection that happens from when you're using the tablets. It's sort of drawing the blood from inside you into those chambers of the penis. So it's more venous blood than oxygen-rich arterial blood. So you will notice that the penis is a little bit blue-coloured sometimes and a bit cooler to touch, okay? Also, it creates a bit of a hinge effect. So if you're having the constriction band on the base of the penis, the penis actually will probably be more in like a sort of hanging kind of position. It's not going to be standing tall and erect, but it will be firmer, okay? So with that band, it's trapping the blood flow in, and then using yourself, you'd have to kind of hold yourself and guide yourself into your partner to have intercourse, just to be on the safe side, because it does create that kind of hinge effect, okay? With the constriction band, you can only really use these for about 30 minutes at a time, just because it does trap blood flow in the penile tissue and stops that oxygen-rich blood flow going through. So only 30 minutes at a time is what's recommended, okay? Another treatment option for erectile dysfunction are intracavernosal injections. So what these are just injections directly into the penis to give you an erection. Now, a lot of men get very scared about the idea of injecting into their own penis. This is something that you'd learn in a clinic, and one of the urology nurses could teach you. I can teach you how to do an injection, and urology nurses can. GPs can potentially teach you, and also your urologist can potentially teach you. Your partner can be involved in doing the injection if you have a problem with needles. The good thing about the injections are they actually work whether or not you've got nerve function, so that's a really good thing, and also whether or not you've got desire or a libido. So these are a really good option for patients who don't have any nerve function after prostate cancer treatment, or if you're on hormone treatment and you have trouble getting that desire or libido to be sexually active. They're about 80 to 90% effective at getting an erection. So really what we do is we inject directly into the side of the penis. Okay, we teach you how to do that. It's a very, very small needle, okay? And when we do the injection, we really start at a really, really low dose, and then we work our way up to get the dose that's right for you. The reason is because there's a risk with this medication that you could get an erection that lasts for too long, and that's a medical emergency, okay? The other thing is some men can get a reaction to some of the medication that we use to inject into the penis, where you can have a painful erection and then you don't want to be sexually active. If that was the case and that happened to you, then we try you on a different medication, okay? The other thing with the injections are we don't use them more than 3 times a week. So if you're going to use injections, you need to inject once only at a time, leave 24 hours at least between injections, okay, and also rotate the injection site. Now, the next option that's available, if all other options fail in treating your erectile dysfunction and your sexual function is very important to you, is a penile prosthesis. So this is an example of one of the devices that's available. There's actually normally 2 chambers, and what these are these inflatable cylinders. Basically, this is an operation that involves boring out the tissue of those chambers, all right, and then they insert these rods into the chambers, all right, and how they work is you've got a little pump that sits in the scrotum, okay, and you've got a little fluid reservoir that sits kind of under your hip bone, okay, so this is all on the inside and no one would see this. Then when you're wanting to get an erection, you'd slowly pump basically the device, and then fluid fills from the reservoir into those chambers, and then you end up with an erection. And when you're wanting to not have an erection anymore, you just press the button, squeeze your penis gently, and then the fluid goes out again. This is an irreversible procedure, so this is something to maybe look at if all other treatments aren't working for you. Before I mentioned about leaking urine when you're aroused as a possible side effect for prostate cancer treatment. One of the things that you can do to help with that, if you find that that's happening to you, is you can actually empty your bladder before you're being sexually active. You can also use a condom with a constriction band over the base of the penis to help trap any extra leakage. And you can also prepare, your surroundings, I guess, before you're being sexually active. So, and you can think about maybe doing it in the shower potentially, or if you're on the bed, maybe laying down some plastic sheeting or towels. So, we've talked a bit about managing the physical side effects of sexual dysfunction from prostate cancer treatment, but a big thing that does impact on a lot of men and their partners is the psychological effects of having problems with your sexual function following prostate cancer treatment. So it's really sad, but a lot of men end up having this kind of fear of failure and performance anxiety after they've had prostate cancer treatment, because there's a difficulty being able to get an erection, and they may kind of have this fear of being able to not perform properly for their partner. Also, patients who, if you're actually single, can be a bit scared about going out and meeting new partners because, again, that fear of not being able to satisfy their partner. Then there's a tendency to really withdraw from any intimacy, and that can have a devastating impact on you and also partners and potential partners. So what I really recommend doing is not withdrawing and actually talking to your partner. So when you're going in for your prostate cancer treatment, really think about what your goals are in terms of treatment, and make sure you talk to your doctor about what what's important to you in preservation. So if your erectile function is important to you, tell your doctor. Talk about your nerve-sparing surgery if that's important to you. If radiation, talk to your doctor about that. What's the likelihood of having sexual dysfunction? And then if you're finding that you do have these impacts from surgery where your sexual function has been impaired, talk to your partner again about that. Also, maybe it's worth discussing how important is penetration to you and your partner. So often men will just assume that their partner wants penetration and they haven't actually spoken to them about it. So, we find that a lot of partners, what they're missing from their sexual activity with their partner is that intimacy. So again, it's worth just talking to your partner about what's important to you. And maybe looking at renegotiating your sex life. So if you can't have an erection and you're having trouble using all the treatment options that are available, maybe focus on pleasure and a connection rather than just getting an erection. A lot of people will go and have a default setting in terms of being sexually active, especially if you've got a long-term partner, but it's worth really sitting down and renegotiating, I guess, how you're going to move forward and be intimate together in the future. Remember, there are treatment options available for erectile function, and there's also toys available. So again, maybe thinking a bit outside the square in terms of what treatments are available to help you be sexually active and have pleasure in your relationship. And talk to your urology nurse. Also there's psychologists available if you're struggling with the side effects of the treatment. There's also sex therapists available. So these are trained clinicians who have often a psychology background and a sexology background. So they can also support you through the process of renegotiating your sex life and maintaining intimacy. And also there's a lot of sexual function clinics out there with trained urology nurses like myself that can help you, I guess, with all your sexual function. We've got trained urology nurses who can help you with sexual function and managing sexual dysfunction.